Bill S05269 is an act to amend the public health law in relation to the establishment, incorporation, construction, or increase in capacity of for-profit nursing homes. I'm Morgan Blake, an occupational therapy student at Keuka College. Why did I choose this policy to advocate for? After reading this bill's description, I immediately knew that this bill spoke to me and reminded me of my time working at a for-profit skilled nursing facility this past summer for my Level 2 fieldwork experience. This is a public health policy under Bill S05269, and it is being debated at the state level in New York State. It is sponsored by Senator Gustavo Rivera, whose picture is featured on the slide, and this policy does not currently have any co-sponsors. Senator Gustavo Rivera represents District 33 in the New York State Senate and is the chairman of the Committee on Health. He is affiliated with the Democratic and Working Families parties. Goals of the policy. It proposes to amend the public health law through prohibiting the establishment or expansion of for-profit nursing homes. Its major intended and anticipated outcomes include prohibiting the granting of new for-profit nursing homes licenses in New York State, as well as prohibiting the expansion of the capacity of existing for-profit nursing homes in New York State. Currently, there are no public health laws in the state that prohibit the establishment or limit for-profit nursing homes from expanding. These goals were clear in the New York State Assembly website. Policy history and development. February 26, 2021, an act to amend the public health law in relation to the establishment, incorporation, construction, or increase in capacity of for-profit nursing homes was introduced into the New York State Assembly by Assemblyman Gottfried. He is also the sponsor of this bill when it was in the Assembly. The policy, known at the time as A05842, was read once and referred to the Committee on Health. On March 1st, 2021, the New York State Assembly reported and the policy was referred to rules. The following day, March 2nd, 2021, the rules report occurred as well as a third reading of the rules. 2 days later, on March 4th, 2021, an act to amend the public health law in relation to the establishment, incorporation, construction, or increase in the capacity of for-profit nursing homes passed the New York State Assembly. The same day, March 4th, 2021, the bill was delivered to the New York State Senate, becoming Bill S05269, and was referred to the Committee on Health. No further action has been taken on this policy since March of 2021. Currently, there is a large window of opportunity post-COVID-19 in relation to nursing home reform in New York State. Calling into action current policies in place to ensure safe staffing, quality of care, and infection control measures. Many debate and criticize our previous governor, Andrew Cuomo's policies on nursing homes, especially a policy issued in March of 2020, which effectively ordered nursing homes to take back residents who have been discharged from hospitals after being treated for COVID-19. The COVID-19 pandemic impacted nursing homes greatly, resulting in thousands of COVID-19 related deaths and contributing to nursing home reform efforts. Interested actors and players. Our formal actors are the New York State Assembly, the New York State Senate, members of the Committee on Health, Governor Kathleen Hochul, sponsors of the bill, both from the Assembly and the Senate. Informal actors include staff of for-profit nursing facilities in New York State, including therapists, social workers, nursing staff, administrators, individuals living in long-term care, individuals that have received care at for-profit nursing homes, and organizations that protect the best interest of the geriatric population in the state. Senator Gustavo Rivera, who is the sponsor of the bill, has supported nursing home reform policies in the past and has had success in introducing these to the Senate. Policy analysis. Major obstacles of this policy include limited transparency that currently exists between nursing homes and the state. And this is in relation to transparency between what they're spending the money on as well as ownership. Many for-profit nursing homes are comprised of a web of related party companies. And also the amount of for-profit nursing homes. There is currently 2/3 of nursing homes in New York State that are for-profit, so it's definitely a large undertaking. To overcome this obstacle, politicians have proposed that more policies related to nursing homes be introduced to increase transparency, and also the creation of a federal task force to audit centers for Medicare and Medicaid services provider enrollment. Overall, through an increase in transparency and clarifying the chain of ownership, nursing home reform can be implemented easier. In relation to occupational therapy, this policy impacts a large treatment setting which occupational therapists practice in. Prioritizing patient care over profit would greatly benefit the populations that OTs serve in nursing homes, as well as prohibiting the establishment of more for-profit nursing homes would allow workers to join non-for-profits where staff is needed and shown to have a higher rate of employee satisfaction. Thank you for watching.